In tonight's Health Edge, it is a tough topic to tackle, suicide, but so many lives and families have been touched by suicide, so what can we do to prevent it?
Chief Health Editor Dr. Partha Nandi joins us now with some eye-opening new information.
Important, there's no real simple cause and no single cure, but a new study finds that maybe a way to reduce some suicides up to 90%. It's not a pill. Instead, a new study finds that we need to secure what's being called high-risk suicide hotspots, bridges, cliffs, tall buildings, railroad tracks. That means simply putting up fences, blocking access to windows or rooftops. And this study also found that putting up suicide prevention phone numbers help, as well as cameras or trained staff in those hotspots to help intervene and decreases the chance of a suicide that's taking place. So listen, this is something that is taking lives every day. So anything we can do to prevent it would be great.
Why is it such a high rate among young people? You were telling us teenagers. It's the number one cause of death. 15 to
24 years of age, number one cause for death. So we were talking before, and the reason why I think is the number one reason for suicide is depression. And only half of people who are depressed actually get treated. And so when you talk to them, they've either missed their pills, haven't taken their pills, and then something triggers it and you commit suicide. But it's a huge problem. While we have this newscast in the 30 minutes to an hour, you'll have 4 people that commit suicide. And, so it's horrible. They die from it. So it's really an important problem, and we have to address it and not prevent it. The other thing is that we've got to talk about it. People are very afraid and are reluctant to talk about it because it's such a sensitive subject. But if we don't, people are going to die.
Yeah, because I even remember a boy committing suicide in my elementary school way back when. But tell me, what are the warning signs that we need to look out for?
Anytime somebody tells you that they have a plan to die, take it seriously. When they say there's no hope, that they're hopeless, they start making plans, like arrangements for their life. And then extreme mood swings, all those tell you that there's a chance that they could be serious about it and take action. I would go to save.org and the 800 number that's there, 1-800-273-8255. If you suspect anybody's serious about committing suicide or has a thought, go to it, because if we can prevent one life, it'd be wonderful.
I bet we have to look out for kids who've been bullied as well, so that's
Bullying
important.
is huge, especially now the cyberbullying, because you face these people.
Right. Thank you so much, Dr. Nandi.
My pleasure.
And if you have a question or a health concern for the doctor, you can email him, Dr. Nandi at WXYZ.com, or send it to us on Facebook or Twitter.
All new